I'm very passionate about pretty much everything recovery, especially collegiate recovery, and we have a great group of schools and great staff in our network. So if anyone in the audience is considering higher education, we have a number of schools where we have recovery support services, and we're building communities of recovery on these campuses. So we're very glad to talk more and to share about what's available on those campuses. So this morning we have an esteemed panel of individuals from the community, legislators, and government organizations, government agencies. So we're going to jump in, and I'm going to just have the presenters introduce themselves, tell a little bit about their background if they would, and perhaps maybe why this is such an area of passion for them. And many of you may have already met the new director of the West Virginia Office of Drug Control Policy, but I'd like to ask Dr. Matt Christiansen to, I'm going to turn it over to him to introduce himself and to talk about some of the initiatives through the Office of Drug Control Policy and maybe what to be on the lookout for the upcoming legislative session.
Great, thank you, Susie, and thank you for that introduction. Thanks for all the 40 top organizers and presenters who made this possible today, and I look forward to being able to share with you some of the hopeful signs around recovery in the state of West Virginia and some of the efforts that we have been working on behalf of the Office of Drug Control Policy and the state. My name is Matt Christiansen, and I'm the relatively new director of the Office of Drug Control Policy. I've been told I can claim the new title for at least a year, so I'm gonna hold everyone to that. I've been here about 3 months, and so as I'm going through this process, I'm still learning about a lot of the state initiatives that are going on. But one of the reasons I did this position is because I'm an optimist and I'm hopeful about the state of recovery and of our communities and our individuals here in West Virginia. And that belief has really been reinforced by all the great community organizations represented on behalf of many of the people that are on this call today that are working every single day on the ground level towards making new connections and enabling and fostering recovery in our friends, family members, and communities. We certainly couldn't do this without all the people on the ground. So for the people here who are, even if you're just interested in this topic, thank you for being here, and thank you for listening and being involved, because it could not happen without an engaged community and an engaged group of professionals that I've seen over the course of my past few months. A couple things to note is that as we've as we saw our peak in substance use and specifically overdoses in the past few years, around 2017 and 2018, we start to saw that decline, as well as in 2019. And it was clear that a lot of many of the efforts and initiatives that have been taken on behalf of the state and other community organizations were having a large effect on the ground, and were really helping to encourage and build communities of recovery throughout the state. In early 2020, as COVID started to pick up, we did start to see some concerning signs. And although I mentioned I'm an optimist, I'm also a realist, in the sense that we saw those signs in news reports, in reports from community organizations on the ground, that substance use was increasing, that rates of depression, anxiety, rates of suicidality, all rates of mental health issues were really skyrocketing with the increased stress and the disruption of our normal social networks around the responses to mitigate COVID-19. The CDC came out with a report which confirmed many of those findings towards the end of 2020, which showed that West Virginia is not alone in our increased rates of substance use, and unfortunately increase in overdoses. And we're not sure exactly the extent to that yet, but we do know that we're not alone in this, that this is a national problem. And that we still have a lot of work to do. So, as we saw early on in 2020, that we noticed some of these trends increasing, we started to look towards things we could do. So we reached out to recovery residences and other organizations to make sure that they had the appropriate PPE. We reached out to do naloxone distribution, among many other things, telemedicine enforcement and support. And so many of our efforts in this next year will involve looking at those specific issues and trying to identify what worked and what didn't, so that we can continue to reinforce the ideas that work. We have are continuing to follow our statewide strategic plan, which we develop in conjunction with the Governor's Council, help to develop in conjunction with the Governor's Council, and it has a variety of different focuses around prevention, substance use disorder treatment, law enforcement interventions, among many others that we're continuing to push this year. We just recently finished our year 2 feedback on our plan, and so hope to have that out before the legislative session to continue to look forward to our policy initiatives for 2021. So, thank you.
Thank you, Dr. Christiansen. I was going to bring up the town hall meetings, and it was quite an impressive schedule of town hall meetings the middle to the last part of December, just before the holidays. And I'd like to ask Delegate Walker if she would like to comment, because I know that she was participated in many of the town halls that I've also attended. So if there was anything that kind of came out from the discussion, from participation from the community in those town halls, did you pick up any themes, Dr. Christiansen, about things that might be picked up and move forward? And then we'll, after you answer that, ask Delegate Walker if she'd like to share any reflections from her experiences of participating in all those roundtables.
I can. Was that one was directed to me? I can go ahead and get started there. Yeah, sure. So we did get great feedback. We had amazing participation across the state. This year we did a little bit differently, and then we focused on topical areas as opposed to geographic areas. So I think we got a really good recruitment of experts in that field from across the state, which was really helpful. In each area we had specific highlights and themes. One is continuing our outreach to and build out of communities of recovery, so people that are in recovery, to try to help reinforce those as much as possible. Much of the feedback was positive, and that they felt like that many of the recommendations that we had were really well placed and targeted and would be very effective in implementation. The other one, just off the top of my head, was looking at data collection and make sure that we are distributing data as quickly and as efficiently as possible to community organizations, so we can mobilize the community response as quickly as possible.
Thank you. And before we go to Delegate Walker, just a follow-up question, and we can put the Office of Drug Control Policy website in the chat so that folks have a link to that. But you have some pretty impactful resources on the ODCP website. Would you like to share with the audience what those are and what type of data that the public can access from that dashboard and other parts of your website?
Mm-hmm. Sure. Yeah, I'd be happy to. The two things I'd like to mention here. One is it's called the ODCP dashboard, which collates data from multiple different sources, from hospitals, from EMS systems, and then some data from the CDC, as well as some of our own internal data on naloxone distribution, and helps to format it in a way that's easy to digest, so that community organizations and people doing local responses can use that data to help inform their outreach efforts. The other one is our treatment and recovery map, which we can get a link to as well, which provides it's a great resource for anyone looking to get into treatment and recovery, and has a listing and a map of facilities in any individual area that would help people bridge that gap. So, thank you.
That's great. Thank you. Okay, we'll turn it over to Delegate Walker.
Good morning, everyone. I'm Delegate Danielle Walker, representing District 51, Monongalia County. Thank you for having this panel. Thank you for inviting me. So I participated in a lot of those town hall meetings, and I did it for 2 reasons. So I could make sure that I was going into the next session with policy that was going to make sure that we place West Virginians first, and that we move our state forward. What I loved about these town halls, the intersectionality. It wasn't just the healthcare providers. It wasn't just insurance companies, but it was the folks who are in short-term and long-term recovery, and not getting a story, but listening to the truth tellers of all in that same space, listening to hear is what we need, is what we want. We are currently fighting an epidemic during a pandemic. And it's very hurtful when you see the overdoses. But you're so hopeful because these folks take it as more as a job. They're doing their job. But participating in these town halls, they put in extra effort by putting in work of making sure that they were including not only the person that was going through recovery, breaking the stigmas, but also trying to care for the family unit as a whole of whatever that may be. So I'm very thankful for those town halls, and I received a lot of information. Thank you.
Thank you. So you mentioned that you went into the town halls kind of with a forecast or a view on the future about potential legislation. Is there any legislation that you're aware of or that you're sponsoring in the works that you might want to share?
So I think I'm going to tag Mike Pushkin. I am still working with a local nurse practitioner here in Morgantown. And we have a meeting set up at the end of the week where we can possibly get rid of some of the barriers when she is trying to treat her patients. Because I think that's also a big part of recovery when you have to hop through so many hurdles, and our healthcare providers have to think outside of the box. It's time that we tear that box down. But I'm going to pass this on to Delegate Pushkin because I know he has more to say.
Welcome, Delegate Pushkin. We'll just turn it straight over to you.
Okay. Well, for those who don't, I know many of you, but for those who don't know me, I'm Mike Pushkin. I have the honor of representing part of Kanawha County in the House of Delegates. However, currently I'm in Laurel County, Kentucky, in the front seat of a car as I'm working. So I apologize for my professional background I have here. I serve with Delegate Walker on the Select Committee on Substance Use and Prevention, and as a minority chair on the Committee on Health and Human Resources. I think what Delegate Walker touched on it, and it's going to, I imagine it's going to come up a lot. But we have been suffering from this epidemic of substance use in this part of the country for a while now, and I think we've done a fairly good job of addressing some of the issues in regards to treatment and harm reduction. I think, but now it's being exacerbated by this worldwide public health crisis that has, one of the root causes of substance use disorder, is isolation, and that's why one of the best remedies is community. And that's what we've lost during this pandemic, and that's why we've seen this problem, exacerbated, whether it's usage going up and accidental overdoses going up. So I think it's very important that with some of the strides that we've made in harm reduction over the years, whether it's been mainly in access to life-saving. Sorry, my phone's going off. As increased access to naloxone, we need to make sure we don't go backwards on any of those matters, on any of those progressive steps that we've taken over the years. I think during the pandemic, we've made some changes to access for telehealth and telemedicine. We might, I think, on the Health Committee, look at making some of these changes permanent. Hold on one second here. Can y'all still hear me? Okay, I apologize. I had something going off on my phone here. Yeah, I think we should look at making some of these changes permanent, even though once, hopefully everything gets back to normal, we still live in a rural state where we do have limited access for some folks to healthcare. That's what I'm actually doing now in another state, taking somebody to receive healthcare. The other thing, I would really like to take a good look at what prevention, real prevention, and what that might look like. And I'm starting to think that a lot of times real prevention doesn't have anything to do with substance use. It doesn't have anything to do with drugs. It has to do, we have a state that is one of the poorest states in the nation. A lot of the elements that we know that cause are root causes of addiction, we have too much of in West Virginia, whether it's poverty, whether it's unemployment, isolation, depression, and that leads to all sorts of negative public health outcomes. So I think that we should really take a look at addressing, childhood ACEs scores. I think, to me, it's these bills maybe shouldn't be coming through the Substance Use and Prevention Committee, but maybe through the Finance Committee. We need to better fund after-school programs, mentorship programs. That's the sort of thing we're going to really need to do if we're going to have better numbers in the future, a better outcome in the future.
Thank you very much. Do we have any other legislators that have joined the call? We have quite a few participants, and it's a little daunting to scroll down, and we've also got some folks joining by phone, so we don't want to miss any legislators that might have joined us. Okay, if not, I'm going to stick with Delegate Walker and Delegate Pushkin. For the benefit of the group and for people who might be joining us today who don't have as much experience in prevention and recovery and reentry, can you tell us when and why this select committee was created and what the goal of the select committee is?
You want me to answer that? The committee was, I believe it was created back in during the 2015 session by when Chief Justice, well, no longer, so Justice Armstead was the Speaker of the House, and he created the committee. And it was in response to, obviously this epidemic that we've been at ground zero for years. During the first couple years, it seemed like there was more of a focus on enforcement. There were a lot of bills that increased sentences, increased penalties. My personal opinion, of course, I serve in the minority of the legislature. My personal opinion is that those didn't seem to make much of a difference and actually created more problems that I would like to talk about in regards to reentry here shortly. We've been through, I think over the past couple years, it's really become a very bipartisan committee under the leadership of the last chair of the committee, who was Delegate Rohrbach, and then under the current chair, who's Delegate Kelly. We've really, it's a nonpartisan committee. We really work together for a common goal of trying to, address this issue in the state. And last year, I think we a lot of good bills came through that committee, whether it's the certification process for residential recovery, family drug court, which is going to have a huge impact. I see Deborah on here. I don't think that the Jobs and Hope bill, I'm not sure if it came through that committee. I think that was more of a product of a subcommittee from the Judiciary Committee that also had the privilege of serving on. Personally, I think that's one of the best pieces of legislation that have come out of the legislature in many years, where we created this program to help people get back to work or back to school, and created this incentive of felony expungement for nonviolent offenders. I want to hear more about that. It seems that's it's been a program that's been working very well. Some of the things I didn't bring up before with bills, we need to, there's a couple, because it's new, there's a couple things I believe we need to address to help them do a better job over there. And I look forward to hearing more about that.
Thank you. Delegate Walker, do you have anything that you'd like to add to what Delegate Pushkin said?
No, he's a senior delegate here.
Well, I would like to give Joe Deegan an opportunity to introduce himself and talk about an upcoming event that folks have an opportunity to become involved in. So Joe Deegan is a very, very long-standing member of the treatment and recovery efforts in West Virginia. I think Joe might have started one of the first, if not the first, intensive outpatient programs at Thomas Hospital. And he is with the West Virginia Association of Addiction Counselors, and wanted to ask him to say a few words about what might be on the horizon, or any information you want to share from WAVEDAC perspective as your role of policy chair, public policy chair.
Sure. Thank you, Susie. And thank you for the opportunity to be here today. I work at Thomas Health, like she said, and business development liaison. I'm a person in long-term recovery. And I'm also involved with public policy with the West Virginia Association of Alcoholism and Drug Abuse Counselors. And we're trying to work together this year with our advocacy efforts with the West Virginia Behavioral Health Providers Association and a new organization called the Appalachian Recovery Alliance. We're going to have a virtual recovery advocacy day on February 23rd, and I can talk a little bit more about that in a second. We work real closely with that select committee, prevention and treatment of substance use disorders, and we're hoping that certain members of that group will participate with us in our virtual recovery advocacy day. One question I have before we leave is that committee actually going to be functioning? Because I hear that some of the, I don't consider it a lesser committee, but that some of the smaller committees or whatever are not going to be meeting. And so I'd like to know whether or not they're going to be active during this session. But because we've had some clarification on a Westford Jobs and Hope issue where we've had some meetings. We don't know whether it's going to require legislation or not, but right now, if you have a CPS case that's open, you can get hired as a peer recovery support specialist, but you may end up not being able to make it to stay in the job. If your name is still on the registry, Susie, was actually participating in that on that issue. We're trying to figure out where get to the bottom of this is. We'd like for that to be able to be expunged. We're really trying to look in the rules where that is a hit. Basically doesn't permit people to actually become peer recovery support specialists to work with peers, in healthcare settings. So that's one issue. We don't know whether or not that would need legislation at this stage, but we're still working on that. Another area that is going to come up is the West Virginia Recovery Residence rules are going to be set up for approval at this legislative session. So that's something that is very important. It's very important that we have recovery residences in West Virginia that are meeting standards and working appropriately with clients, and that West Virginia Alliance for Recovery Residents is functioning very, very well, and we hope that bill passes. The one thing that we're working on right now is a mental health parity bill that we're trying to, there's federal parity legislation that's been passed years ago, and we don't know, we don't believe that really it is being enforced at the state level. So there are national models models of that legislation. It's called the Jim Ramstad Model State Legislation to Advance Mental Health and Addiction Parity by requiring compliance with generally accepted standards of care. And so we're working with NASW, our group, and the Behavioral Health Provider Association. There may be a bill or two that we're hoping to get introduced. We're looking for supporters in the House of Delegates or in the Senate to come on for those two issues. Other than that, like as far as legislation right now, we won't know what is going to be on the horizon until the first day the legislature opens up. Like there are probably a lot of bills from last year that are going to be reintroduced at the beginning of the legislative session. So right now we're not, completely sure exactly what's going to be on the horizon, and so we're paying a lot of attention right now to exactly what is going to be transpiring, as the legislative session opens up. As far as our virtual advocacy recovery day, we're going to have 4 sessions. The first will be Matt will be with us, and we're also hopefully we'll have Delegate David Kelly, who's the new chair for the House Committee on Prevention and Treatment of Substance Use, and Dr. Rahul Gupta, who was the team lead for the Biden transition team for the Office of Drug Control Policy. I know that they have a new acting person that was placed in that role. We're reaching out to see whether or not that person or whether Dr. Gupta can still present kind of like what the plans are for the initial plans for the Office of Drug Control Policy, and then myself, and then we'll kind of have a panel discussion at the beginning. Then we're going to move into a presentation by Cynthia Marino-Tui, who's with NADAC, our national, we're a state affiliate for NADAC, the Association of Addiction Professionals, and she will present on national credentialing standards for addiction professionals and implications for West Virginia. She'll talk about workforce issues. There's a variety of things. We don't have licensure in West Virginia for addictions professionals, but we do see, the people that get involved with our arena have a passion for substance use disorders, and we want to make sure that the people that are in the arena that are licensed are getting the proper training and the continuing education. The third session will be a presentation from Ellen Weber, who's with the Legal Action Center in DC, on federal parity, federal parity for substance use disorders, and has parity become a reality in the states. And she and a woman by the name of Sherry Layton have presented at national conferences on this topic. And then finally at noon, we'll have a person in long-term recovery talk about how to be an advocate and in person in long-term recovery, and from lived experience. How do I work as an advocate with being in recovery, and how do I utilize the reality of being a person who has a disability, and how to be a more effective advocate. So that kind of summarizes where we're at right now. There's a lot of other topics that I could throw out there. We're hoping to even actually have a smaller couple of roundtable discussions, even with the committee that were the substance use and prevention committee, and maybe even another federal roundtable in the next month or so, in February and March. Thank you for letting me be a part of today.
Sorry about that. I was myself muted. We put a link to the registration to the event, and I believe it's a free event to attend, Joe, but if individuals want continuing education, there's a $20 cost for that continuing education certificate.
Yes, that's correct.
So those are some great things to be on the lookout for. I'm glad that Delegate Pushkin mentioned Family Drug Court, and that's being expanded to other areas of the state. I did want to go back and see if either Joe or Delegate Pushkin, or I think Emily Burkhead is in the meeting, in terms of the rules with the recovery residences. Would anyone like to give a little more clarity to, what that is, what that's going to do to benefit the public and, protection of a vulnerable population?
Do you want to speak to that?
Sure. I mean, I don't know if people in West Virginia, one of the things that's unique about our legislature and how we do things is when we pass a bill that changes the way an agency does something, no matter what it is, and they have to write a rule, that rule then comes back through the legislative process for approval. And that's what's coming back is this rule. There was, I think there was an amendment made during the rulemaking review committee. I don't foresee any issues, any more changes to the rule. It's just the rule is coming back for approval. I do think that we need to look at how it's, how it's been enacted in West Virginia, just so there aren't any, it's a phrase we like to use a lot up there, any unintended consequences that have gone along with this rule. The main purpose of this was to create a set of standards that residential recovery facilities have to, adhere to if they are to get state funds or state referrals. And so far, it seems to be working pretty well. There's a couple of issues we need to work out, but that's usually how it is with any new law.
And Emily, if you want to jump in and say anything about that, or Dr. Christiansen, while we're on that topic, if anyone has any other comments. And then for our folks in the audience, because it's almost 20 to 11, if you have questions or comments that you want to pose to anybody, any of our speakers, feel free to put those questions in the chat.
I can just comment briefly on learning newly over the past few months about the West Virginia Alliance for Recovery Residences processes and procedures, and I've really been impressed by the diligence that they've done in the particular residences and the on-site visits and the requirements that they hold the programs to. And the point here obviously is to make sure that these programs are serving their clients and encouraging a lifestyle of recovery as opposed to taking advantage of those clients. And we've certainly heard some bad stories, but those are relatively rare compared to all the good operators out there. And this makes sure that we have some standards that we're holding people to, so that we're providing the best possible services in the state. They're using a national set of standards, which are similar to the ones used in Ohio, but customized a bit for West Virginia and the differences in West Virginia. But otherwise, it's as far as I'm concerned, it's been a really effective implementation. So.
Thank you. A question that I did want to pose to Delegate Pushkin and anyone else who would like to respond is there seems to be a lot of ongoing confusion from the public and others about naloxone, the protections afforded by the Good Samaritan law. So would anyone like to respond to that and maybe also cover what changes happened that expanded access and distribution of naloxone during last year's session that folks might not be aware of?
I'm not sure if it was last year or the year before, but we've over the past several years, we've expanded access to naloxone. That's a good thing. That's something we should have, we should be doing. That's the essence of harm reduction. We're trying to cut down on the amount of accidental overdoses that we have in this state. I think we've seen some changes in the number due to some of the accessibility we've created for naloxone. I'm not aware of any particular misconception that might be out there. One thing you brought up, the Good Samaritan law, and the one thing I would like to bring up is we passed that law in 2015. And it simply says if you are with somebody who overdoses, that you can call 911 without fear of being arrested or being charged with possession or with, I even believe, like low-level distribution. It's to encourage people to make that call and save that life. I don't feel there's been a good enough public information campaign that has gone along with that. I don't know if people are aware. I'm not even sure if local police forces are aware that this law is on the books. But the purpose of it was to save lives and get people help. We can't get people help if they're not alive. So I know that there's a group that has sprung up just around that one bill to push for a better public information campaign regarding letting people know, letting our police officers know that this law exists, and if somebody calls that are out to get help for somebody who's overdosed, that they have immunity.
What about, we do have a question in terms of any progress toward adopting co-prescribing practices, and I don't know if either one of the delegates or if Dr. Christiansen wants to speak to that, to see anything to help get, when people are prescribed an opioid, to have co-prescribing of naloxone taking place, along with some education for those individuals who are being prescribed opioids and their families, so that they know what to look for in case of an accidental overdose.
I can comment on that briefly. There's a few different initiatives that we've looked at, and from an evidence-based standpoint, there's clearly a lot of support for co-prescribing, especially once you reach a certain amount of opioids per person that are dispensed in someone who has chronic, severe pain. It's not only for that particular person, but it's also for if their kids were to get a hold of it, if a family member were to take it, if they fell on the floor and their dog were to eat it. All those are, there's all kinds of contingencies there, and just like we recommend fire alarms in a house, and we hope we never need them, we also should have naloxone in every household that has a certain, that has a significant amount of opioid medication there. There is still more work to be done here, and it's something that, there's a few different venues for that. One is prescriber education and making sure that we're getting appropriate education out to the people that are writing those medicines, making sure that we are educating on best prescribing practices, which we've made a lot of inroads on in the past few years, working with the Board of Pharmacy to ensure that prescribers are being notified, and patients are being notified too if they're on a dose that's higher than average risk. And then also looking at medication-assisted treatment programs and making sure that they are dispensing naloxone on a regular basis. And that's something we've done some internal discussions on, and would have to do a little bit more research to see if there's any more legislation needed in that area. But Delegate Pushkin might have some, or Delegate Walker might have other ideas there. So thank you.
I think with some of the changes we've made over the years, it doesn't require a prescription now. I think it'd be more of a recommendation that would go with, please correct me if I'm wrong, more of a recommendation that would go with the prescribing physician who prescribes the pain meds, because it doesn't require a prescription now.
That's correct. So anyone can pick up naloxone from a pharmacy just at their request. It does help, I think, to have that physician sign off, or to send it to the pharmacy. There's an expectation that they pick it up sometimes, because if it's voluntary, sometimes it might not happen. Or people might just say, I don't need that because I've been in recovery, or I don't have addiction, or it's not a concern for me. But it's not just about that particular person. It's about everyone that's around them or might have access to. So that counseling really helps.
I agree 100%.
So one quick question, since Dr. Christiansen brought up medication-assisted treatment. Could you speak any to the recent changes in the limitations of prescribing of medication-assisted treatment options?
Sure. Around specifically around the response to COVID-19.
Mm-hmm.
So there have been a few changes that were enacted, sort of from an emergency standpoint, as COVID-19 was bearing down on us, and we had to break up many of the in-person groups and other in-person visits across the state. So one is that that medication limits were expanded somewhat, and that will all need to be reassessed at some point once we're able to get some relief from COVID and understand what our new life looks like after that. But also telemedicine visit requirements were loosened quite a bit too, not only on the federal level but also at the state level, to allow for virtual visits and phone-based visits with similar reimbursement, which in a rural state like West Virginia has allowed us to maintain access to a lot of services in spite of our distance and how rural our state is. And so I think it is something that would be beneficial to look at it in the future as to what the pros and cons are there, and if there's been any unintended consequences of those rules as well. We don't really have all the information yet because we're still in just kind of cleanup mode for right now and trying to make sure that we're providing as many services as we can. But hopefully within the next 6 months or so, that things will start to clear up once we know the trajectory of the virus.
Was there also just recently, within the last week, a change in the number of patients that doctors could see, the physicians who have the waiver?
If you're referring to the rule, the SAMHSA rule about the DEAX requirement, so the DEAX requirement is a requirement for anyone who prescribes medication-assisted treatment to do an 8-hour training. At the end of the previous federal administration, that rule was rescinded. However, there is some concern that they may need to go back and revisit that to make sure all the paperwork is done and that it was done properly. So as of right now, everything is still the same. And so I would counsel anyone, if there are prescribers on the call, to wait for further guidance until we know more, because we just it's still up in the air, and to see how this new administration will respond to that action.
Okay, that's very helpful, because sometimes you just catch sound bites on the news and that doesn't really fully explain how that's really going to impact individuals who are in need of treatment. So there are some, I'm not sure if our presenters can see some of the comments in the chat. We have a little bit of conversation going on about the issues with the barriers for people that have had CPS cases in the past, and it is definitely a barrier. I think it also, and I don't have any data on this, and I don't know if we need to do something to collect some data about how many people have been impacted by that rule, and what does that look like in terms of disparities and any discrimination. Is there a particular group of individuals, are there people who are more likely to have open CPS cases based on gender, race, ethnicity, and what does that look like in terms of approaching that from a equity standpoint?
Well, I mean, in my opinion, that would be all the more reason why it'd be beneficial to help somebody get better employment to begin with, and that's one of the goals of the Jobs and Hope program. So, I look forward to working with that agency, and we have several different issues we want to address, because I mean that's also it's a new agency that was created by new legislation, and there's a couple things that need to be worked out as far as licensing requirements for people who have criminal backgrounds. One big issue is this Medicaid cutoff, where we're trying to get people to be better employment for folks, and then once they make over a certain amount of money, they are in risk of losing their health care, and also if they're on in a medically assisted treatment program, then they would also lose their access to that. It's something we really need to address. I would like to do a more broad-based way to address it, not just for folks who have substance use disorder, but it's an issue for a lot of folks who are on Medicaid. You get a better job, and then all of a sudden you are on your insurance. Your access to health care is greatly decreased. We should be incentivizing work instead of what the system we have now. If we're not able to get a broad-based approach to it, then maybe something's just focused on the issues that they're having at Jobs and Hope with people who have substance use disorder. Other things that we need to, there were several issues I'm working on with them. I wanted to get this out though too, because we brought up reentry, but we haven't really addressed it. There is a major bill that several of us are working on that would create a reentry program modeled after the federal program that West Virginia does not have. They actually have a real reentry program for West Virginia, and that would address so many issues that we have in the state, whether it's prison and jail overcrowding and recidivism. And this would create a program for certain type of offenders 6 months before they're eligible for parole to get them into this program so they can have a better home plan for them once they get out. So that's something we really, I'm hoping that the governor's administration takes this bill up. So I'd appreciate any kind of help I could have with that. I think it's a great idea. It came to us from the several of these reentry councils that meet all over the state. They have wonderful ideas. They brought this idea to us. I think it'd be a great idea for a governor's bill, really.
And we have a question in the chat about how could advocates and allies help with that bill?
I would start with the governor's office. They'll be made aware. They've been made aware of it. We're working out the bill now, like getting it, going through the drafting process, and I'll be taking it to the folks over at Corrections, and they will be aware of it. And I think it would be an excellent part of the governor's agenda. So I would call them first, and then call members of the House and Senate Judiciary. Just call anybody that has any kind of influence over this, whether it's people in the legislative branch or the executive branch.
And I think that's one of the challenges that we have is, there are people, as you can see in the chat, tons of people posting that they would love to help, they'd love to support that. But there is kind of a lack of a mechanism to communicate information about what's being proposed out to people who can mobilize to then, activate and exercise, their relationship with their representatives, saying that they support a particular bill or law or changes to various legislative rules. So what's the best mechanism? Is there a statewide group? Is there a mechanism to keep the public informed about, various bills?
Yeah, for different issues, there's usually an advocacy group or several that on the statewide level that are out there pushing for it. With that last bill I brought up, that reentry bill, of course, the American Friends Network. I think a lot of counties now have reentry councils. Your local reentry council, that's where the bill came from, and then American Friends Network are advocating for the bill. As far as the Medicaid bill, there's West Virginians for Affordable Health Care would be a group that would be advocating for that. And there was another bill that I was getting ready to bring up. I'll think of it here in a second. Sorry.
Delegate Pushkin.
But there's always a group out. There's always a group out there that's organizing for a certain bill, and better not to reinvent the wheel, but to contact them and help.
Delegate Walker, when we first started the hour and we mentioned we wanted to have a little bit of time to address reentry, I wanted to get back to you to give you some time as we near the end of the hour to talk about what might be coming and what you want folks to know.
Reentry is something that I'm very passionate about. Before the pandemic, after last session, I had a visit at Mount Olive Prison with Commissioner Deegan. What I see when we start this reentry process is that we have no voices from the inmates. We have no voices from the family. We have no voices from the community. We have a housing issue here in this state. What we don't realize is that wherever these folks were when they first entered the jail and the prison system, life has changed as it changes every day for us on the outside. The programs that we have set in place for these individuals, it's not successful all the time. Once they leave a structured housing environment, what do we do for them at that point in time? What do we do for them when they have to do a housing application and it says, have you been convicted of this or that? I feel that we need a separate type of housing, Section 8, for felons and inmates. I have so much to say about reentry. Ban the Box can bring more discriminatory practices if we remove that question. And so we need to make sure that we are not only giving the employer implicit bias training, but we make sure that we are allowing these former inmates to have that same training so they can pick up on when they're being discriminated against. That's a big one. And mental health. We have several Medicaid programs if someone needs a spin down. But where's that mental health Medicaid program once these people come back home? And so that's where I'm at with reentry. A lot of these folks don't even know about the Jobs and Hope program. I would like to see something to where, just like when they go up for parole, that we have in their packets that they can be registered voters. Because a lot of them don't know that they can even register to vote or that they've earned that right to vote again. And so it's a lot of educational pieces for me with the reentry. Thank you.
Thank you. And I think, as we have just a very few minutes left in our hour, and we want to be respectful of everyone's time, I think that we could definitely schedule a follow-up conversation and have a whole hour to focus on reentry issues. And, I have seen several people post in the chat, that they, have had that lived experience and can tell firsthand what needs to happen. And, so if we can use this platform to help give some voice to those things, we would love to do that. We also have a West Virginia Recovery Advocacy Project headed up by Joanna Vance, which is a resource. And we have, starting today, the West Virginia Prison Reform Conference starts this evening, and I put that link over in the chat as well. So that's going to run this evening through, I think, Saturday. So if folks are interested in getting more information about what's going on in West Virginia with reentry, that'd be a great place to start. And I know that Delegate Pushkin and Delegate Walker are going to be featured speakers, as well as a couple of our own peer recovery support specialists are going to be speaking at that event. So we are really, we're scheduling a series of barriers to entering higher education and addressing those barriers, and some of that relates to people who have prior incarceration, and helping kind of dispel the myths and look at, how we can address and remove those barriers to help people who want to further their education, who might be coming out of some type of correctional setting. So I'm going to pass it back to Sarah to close things up, but I just want to thank everybody very much. This has been very informative, and I really appreciate your time and your expertise and your passion for doing this. And we wish Delegate Pushkin a safe trip back from from the outer regions of Appalachia. And Sarah, I'll turn it back over to you.
Sure. Susie, can you hear me? Okay. Well, thank you so much. What a informative session. Again, as I agree with Susie, we could schedule many more sessions in regards to these topics. They're very important to our state and really our nation. And we will schedule additional conversations to do a deeper dive in all of these. Thank you so much for joining us today. Next month, we're going to be looking at economic development and higher education deadlines approaching. And we will have a 40 Top schedule every month in 2021. So we hope that you can join us for these conversations. We definitely need your input and appreciate all of your expertise. Thank you so much. Please stay safe, and we'll see you next month.